Check Your Health is sponsored by Intermountain Health and the Utah Department of Health and Human Services.
People living in remote areas who've been diagnosed with cancer can now have more access to treatments.
We use telehealth to connect to rural communities so that they don't have to travel for cancer care.
Telehealth oncology has been especially useful in Fairbanks, Alaska, where patients have faced significant barriers to getting cancer care.
Patients would have to drive hundreds of miles or even sometimes take a helicopter to the next rural cancer center. And that just means a huge burden for our patients, not only financially, but figuring out logistics to be able to get that cancer care.
After an initial in-person treatment, many patients can continue follow-up care remotely, including some lab monitoring and consultations.
We use two-way telehealth technology so the patient can see the provider and hear the provider, and the provider can see the patient and hear the patient, and then they go through the consultation that way. Once treatment is determined that it is needed, then they will order chemotherapy, and they will mix that chemotherapy on site and provide the infusions in that infusion center.
Telehealth oncology teams have diagnosed and treated a dozen cancers or blood disorders, from iron deficiency anemia and stage 4 prostate cancer to breast cancer.
We are in Utah, Idaho, Montana, Wyoming, Nevada, Alaska, and soon to be Arizona, Colorado, and New Mexico. So we've really focused on what areas have a high cancer population and those hospitals that we could partner to bring cancer care close to home in those states.
I'm Mary Nichols. For more information on cancer services, go to KUTV.com and click on Check Your Health.